Hello and welcome to this educational video. Today, we will explore in detail the anatomy of two crucial regions of the human body: the axilla, or axillary region, and the heart. This course is specially designed for medical students to strengthen their fundamental knowledge. Let's start with the axilla. The axillary region is a transitional space located between the upper part of the thoracic wall and the arm. Its shape and size vary depending on the position of the arm, becoming almost imperceptible when the arm is in complete abduction. It is a vital passage area for blood vessels and nerves that travel from the base of the neck to the upper limb. Anatomically, the axilla can be described as a truncated cone, possessing an apex, a base, and four walls that we will detail. The apex, or cervico-axillary opening, is bounded by the first rib, the clavicle, and the superior border of the scapula. This is where arteries and nerves pass to the arm, and veins and lymphatic vessels in the opposite direction. The base is formed by the skin and axillary fascia. It is bounded by the anterior and posterior axillary folds, formed respectively by the pectoralis major and latissimus dorsi muscles. The anterior wall consists of the pectoralis major and minor muscles, as well as the clavipectoral fascia. The suspensory ligament of the axilla connects it to the skin. The posterior wall is formed by the subscapularis, teres major, and latissimus dorsi muscles. The medial wall is composed of the first four ribs, the intercostal muscles, and the upper part of the serratus anterior muscle. Finally, the lateral wall, narrower, is formed by the humerus, the tendon of the long head of the biceps brachii, and the coracobrachialis muscle. The axilla contains major neurovascular elements, namely the axillary artery and its branches, the axillary vein and its tributaries, nerves from the brachial plexus, as well as lymphatic vessels and nodes. All are wrapped in the axillary sheath and adipose tissue. The axillary artery, which follows the subclavian artery, begins at the lower border of the first rib. The pectoralis minor muscle divides it into three parts. It ends at the lower border of the teres major muscle to become the brachial artery. The first part gives the superior thoracic artery. The second part gives the thoracoacromial artery and lateral thoracic artery. The third part gives the subscapular artery and anterior and posterior circumflex humeral arteries. Now let's move to our second subject, the heart. This vital muscular organ is the central pump of the circulatory system. We will examine its position, external and internal structure, vascularization, and electrical conduction system. The heart is located in the middle mediastinum, protected by the pericardium. It is oriented obliquely. The apex points forward, downward, and to the left, while the base is posterior. The pericardium is a fibrous serous sac that envelops the heart. It consists of an external fibrous pericardium and an internal serous pericardium, itself divided into a parietal layer and a visceral layer, or epicardium. The heart has four chambers. The two upper chambers are the atria. The right atrium receives deoxygenated blood from the body via the superior and inferior venae cavae. The left atrium receives oxygenated blood from the lungs through the four pulmonary veins. The two lower chambers are the ventricles. The right ventricle pumps deoxygenated blood to the lungs via the pulmonary artery. The left ventricle, more muscular, pumps oxygenated blood throughout the body via the aorta. Unidirectional blood flow is ensured by four valves. The atrioventricular valves are the tricuspid valve on the right and the mitral valve on the left. The semilunar valves are the pulmonary valve and the aortic valve. The heart is vascularized by its own vessels, the coronary arteries. The left coronary artery and right coronary artery arise from the ascending aorta and branch to irrigate the myocardium. Venous blood is collected by cardiac veins that drain mainly into the coronary sinus, which opens into the right atrium. The cardiac rhythm is controlled by a specialized electrical conduction system. The impulse originates in the sinoatrial node, the heart's natural pacemaker. It then spreads to the atria, then to the atrioventricular node, and finally to the ventricles via the bundle of His and Purkinje fibers, causing coordinated contraction of the myocardium. We have explored the complex anatomy of the axilla, an essential